Hi, it's Dr. Tyler Kowalski with Kowalski Chiropractic, and in today's video I'm going to be talking about tailbone pain, kind of that pain in that really low part of your back. This can be caused by trauma if you've had a fall, or from repetitive sitting. If you have a job where you sit a lot, sometimes it can cause that low back and pelvis to get really jammed up and cause some pain in the really low back and into the tailbone itself. So the first thing we want to do is if there's any kind of tension in the ligaments, muscles that all kind of connect right to that tailbone area, we want to get rid of that tension. And then the second thing we want to do is make sure the joints in that pelvis and into the tailbone are moving well. And when we free up all that tension, get everything moving well, a lot of times that'll take care of the pain. Because a lot of times when we're talking about tailbone pain, it's the nerves that come out of that low back and pelvis that are getting irritated, and that's what causes that sometimes shooting pain or just that constant pain in that low tailbone area. So the first way we can get all these kind of ligaments and muscles loosened up is just with this gentle muscle massager. Just kind of will run over the patient here. So we usually do this for 2 to 5 minutes, just a couple minutes, just nice and easy, just getting all the soft tissues loosened up here. And then we want to make sure the low back is nice and decompressed and moving well. So with our table here, we'll unlock it and we'll just kind of stretch out all the ligaments and muscles that kind of connect right to that tailbone and low back area here. So my table kind of moves up and down while I'm just gently just decompressing and stretching all this out. And then we can go side to side with the table here, and depending on which side the patient might have more pain. I think today it was more on the left side, kind of right through here he was complaining, and so we want to make sure all the ligaments that kind of connect here are stretched out and moving well. And so we do this for another 5 or so minutes, just getting all that tension out of there, getting everything stretched out and decompressed. And then we always, when we're talking about the tailbone, you have this sacrotuberous ligament that runs from each side of the leg and kind of connects right at the tip of the tailbone. We want to make sure that tension's out of there. So there's a few stretches we kind of hold and just get this ligament loosened up. Just making sure both sides are moving well there. And yeah, definitely this left side is a lot tighter. So we would hold this maybe another few minutes, wait for this to release, get all that tension off the lower tailbone there. And then once all the ligaments, muscles are all nice and loosened up, then we're going to check this sacrum bone here, right here where that runs into the tailbone. And I'm going to put a little pressure here. I'm going to have him raise this leg up in the air as high as you can, and then back down. Same thing other side, and then back down. Do that one more time, and back down. And then I'd ask him, did one of those feel harder to raise the leg? Like your left leg or right leg?
Yep.
Which one felt worse?
Left one.
Okay, so the left one felt harder to raise, and that's where you had the pain on that side. So that's where it also feels restricted a little bit on this side. When we're talking about the pelvis and sacrum right here. So that's the side we're going to adjust and get that loosened up. So I'll have him go on his side facing me this way. Good, we'll bring him a little closer. And then one spot right here, we'll gently adjust him here. Good, and we'll have him go on his back. We also want to make sure the hips are moving well here. Good, lined up there. So that's an example of a treatment for kind of tailbone pain. Just get all the muscles, ligaments loosened up, get the joints adjusted and moving well. And a lot of times after a treatment or two, that'll help relieve that pain there.